Guidance for gastroscopy. This video is made to explain to the clients what gastroscopy is, what its benefits are, how it is done, and what should be done before the examination. This may serve as a guide to preparation and a safe procedure for those who are having gastroscopy. Purpose and effects of examination. Gastroscopy is a procedure, often called upper gastrointestinal endoscopy, which enables a doctor to directly observe the inner wall of esophagus, stomach, and the first part of duodenum using a scope inserted through the mouth. The disorders that can be found in this exam are esophagitis, esophageal varix, gastritis, and any suspicious lesions for gastric or duodenal cancer. Most significantly, as stomach cancer often occurs in the mucous membrane, the inner layer of the stomach wall. A gastroscopy directly observing the mucous lining and the digestive canal can successfully find the suspicious lesions better and earlier than other examinations, allowing biopsy of those lesions. Most people do not feel any symptoms at the onset of stomach cancer. However, if found at the early stage, most stomach cancer can be successfully treated and cured without serious complications. Thus, for people above 40 years of age, an annual gastroscopy is strongly recommended, even though symptoms are not present. Clients may feel nauseated and get strained when the scope is inserted into the throat. This natural reaction, accompanied by this examination, is very hard for a client to endure, and it can also be an impediment to conducting a precise examination for an endoscopist. When the client chooses to be sedated during gastroscopy, he is to be given a sedative injection right before and fall asleep during the procedure. Unlike those under general anesthesia, sedated clients can still have consciousness and respond to verbal orders or light stimulations of an endoscopist, and some clients can awake during the procedure. But clients under sedation feel less pain and do not move their body around excessively, allowing a more rapid and accurate examination compared with those without sedation. However, there are clients who need to undergo caution for the use of sedatives: the elderly age 70 or more, clients with lung diseases such as asthma and emphysema, and kidney or liver failure, pregnant or breastfeeding women, are not recommended for sedated gastroscopy. Preparation before examination. Tell the medical staff in advance about your medical history and current health status, allergies, medication for a safe examination. Inform the medical staff of your current medications and ask if you should stop or continue your medicine. Before the examination, fasting is required for 8 hours to empty the stomach. Clients should eat a light dinner the day before the test. Water is acceptable until midnight prior to the procedure, but no water afterwards. Before the test, take off dentures, jewelry, etc., and store them safely. Remove lip color if indicated. It is recommended that the client be accompanied by a guardian, because unexpected situations can occur during the examination, or a client may need help post-procedure. Procedures and methods. It takes 5 to 10 minutes for the gastroscopy, and if the client opted for sedation, it will be extended to about 30 minutes because he needs time to recover from the sedation. For a clear view, the client takes liquid medication to remove bubbles in the stomach, and injections are given to suppress stomach movement before the examination. Clients may experience blurred vision or increased heart rate temporarily after the injection. These are brief, normal reactions and go away soon. Therefore, they should not be cause for alarm. Intravenous lines are connected to administrate medicine and fluid. Spray a local anesthetic agent down the throat to prevent a gag reflex. Lie the client down on the left side, as shown in the picture. Put a mouthpiece into the mouth to fix the tongue and prevent any injury. Then, sedative medication will be given into the vein. Endoscopist will insert an endoscope through the mouth and proceed it toward esophagus, observing the inner wall to find any inflammation and suspicious lesions for cancer. The tip is then advanced into the stomach and inspects antrum and pylorus, and through the pylorus down into the first part of the duodenum. If there are no signs of abnormality, the doctor may move the scope backwards and bend it like a J shape to inspect the body and fundus of the stomach. During this procedure, if any abnormal findings are detected, pictures are taken and specimens are obtained for microscopic examination. The biopsy results will come out in 1 week or so. Precaution during examination. Follow instructions for a safe and accurate procedure. The client may feel uncomfortable when the endoscope is inserted through the mouth. But to prevent any possible damages to the mucosal layer, take a deep breath and let the saliva drool down the mouth. Precaution after examination. Following the examination, clients take a rest for about 30 minutes. However, clients may continue to feel dizzy or lightheaded after the rest, so clients are advised to be accompanied by a guardian and to avoid driving him or herself or making important decisions following the procedure. Air introduced into your stomach for a clear view may cause discomfort, and a sore throat and blood spotting can be experienced because the scope stimulated the throat. But these symptoms may pass away soon. Clients can drink or eat food after the effects of the anesthesia are completely resolved, taking usually 30 minutes. If biopsy was performed, patients must wait approximately 2 hours before eating or drinking. The meal should be started with light food like porridge. Avoid alcohol, coffee, smoking, and spicy food for 2 to 3 days afterwards. Complications and side effects. Gastroscopy is a safe procedure, but may have such complications as following. Hypersensitivity due to medication. Dizziness, urticaria, and asthma can occur because of the medication used for a better examination. Local complications. Hemorrhage or perforation, if rare, can occur at the biopsy site. If a client has vomiting of blood, severe abdominal pain, or hypotension, he should visit the emergency room as soon as he can. General complications. Elderly or those with risk factors may experience arrhythmia, heart attack, hypoxia, pneumonia, stroke, etc. Even if those are very rare, they can be fatal. Examination failure. The procedure cannot be performed when the client does not cooperate or if a sedation does not fully take effect. Also, the doctor should not hold the procedure if the client shows dyspnea, hypoxia, hypotension, etc. Alternatives. If you failed the gastroscopy, upper gastrointestinal tract radiography can be done, which is a radiologic examination of the upper gastrointestinal tract. Clients first drink a contrast agent, typically a thick, chalky liquid containing a barium salt, and then take a series of X-ray images observing the shape of the esophagus, stomach, and duodenum. But these images can just show the abnormal shape of the tract and do not allow direct views of the stomach wall or an access to biopsy or an exact diagnosis when suspicious lesions are found. Now we have briefly reviewed about gastroscopy and precautions for a safer and successful procedure. Thank you.